it was actually disputed who the actual discoverer of anesthesia was. It was split between three different individuals in history. Using the magic of AI, or A1 as some people like to call it, we are going to go back in time and talk to none other than Dr. Crawford Long of Jefferson, Georgia today. Dr. Long, thank you for joining us. Let's start by discussing your most notable accomplishment, your early use of ether as an anesthetic. Can you tell us how you came to discover its property and decided to use it in surgery?
Thank you for having me. My journey began in March 1842 when I witnessed a friend experiment with ether during a gathering. I was intrigued by its effects, especially how I could induce a state of joy and insensibility. After observing its potential, I decided to test it on a patient for minor surgery. I felt a moral obligation to relieve pain. When I successfully excised a tumor from the patient's neck while he remained entirely unaware of the discomfort, it was a transformative moment for me.
Tumor from the neck, pretty sick. However, your discovery wasn't widely recognized at the time. What challenges did you face getting your findings acknowledged?
Yes, the journey to recognition was fraught with difficulties. I was hesitant to publish my findings initially, as I was concerned about the potential backlash if it didn't meet expectations. Furthermore, my practice was in a rural area, which limited the audience for my work. By the time the other dentists like Horace Wells and William Morton gained visibility in their contributions, it felt as if my earlier efforts were overshadowed. There was a struggle for credit and indeed was frustrating.
Look at that, 1842 got some moves. So how did you feel about Dr. Wells and Dr. Morton's demonstration of anesthesia, especially given your earlier work?
I respected both of them for their enthusiasm and contributions to the field. Dr. Weld brought attention to nitrous oxide, and Dr. Morton's public demonstration of ether was crucial in gaining traction for anesthesia. While I wished I had received recognition sooner, I was ultimately pleased that the medical community was beginning to accept and adopt anesthesia, which was my primary goal, reducing patient suffering.
Whoa, buddy, no. Oh, that's just your ether mask. My bad.
In hindsight, what do you consider your greatest legacy in the field of medicine?
I believe my greatest legacy in the foundational role I played in the development of anesthesia. Though I may not have garnered the fame that others did, my work contributed to revolutionary shift in surgical practices. Today, patients can undergo surgical procedures with far less pain, and I hope that continues to save lives and improve well-being.